Cidofovir Vial is used with probenecid to treat a certain viral eye infection called retinitis due to cytomegalovirus, CMV, in people with AIDS. This medication helps lower the risk of blindness and other vision problems. Cidofovir belongs to a class of drugs known as antivirals, and it works by stopping the growth of the virus. It's important to note that Cidofovir is not a cure for CMV retinitis, and the disease may still worsen during and after treatment. For the daily dosage and optimal timing of Cidofovir Vial, it's best to consult with your healthcare provider. When it comes to using Cidofovir Vial, the dosage and administration are crucial. Your doctor will give you this medication through an injection into a vein, usually every 1 to 2 weeks. It is important to receive this injection slowly over the course of 1 hour, and it should never be injected into the eyes to avoid the risk of permanent vision loss. The dosage of Cidofovir Vial is determined by your medical condition, body weight, and how you respond to treatment. Before receiving the medication, you will typically be given 4 fluids, and your doctor will also instruct you to take probenecid by mouth before and after the injection. It's important to drink plenty of fluids, especially if you are experiencing vomiting or diarrhea, to prevent kidney problems. If you are administering this medication to yourself at home, it's essential to follow the preparation and usage instructions provided by your healthcare professional. Before using the medication, check for any particles or discoloration in the liquid, and do not use it if either is present. It's also important to learn how to store and dispose of medical supplies safely. To get the most benefit from Cidofovir Vial, it should be used regularly. Make sure to keep all your medical appointments and consider marking a calendar to help you remember. It's also important to use probenecid exactly as prescribed by your doctor, as it can cause nausea and vomiting, which may be prevented by taking it after meals. It's critical not to use more or less of this medication than prescribed or to stop using it, or your HIV medicines, without your doctor's guidance. Doing so can lead to an increase in the amount of virus, make the infection more difficult to treat, or worsen side effects. Lastly, to avoid any direct contact of this medication with the skin, eyes, or mouth, make sure to wash thoroughly with soap and water if contact occurs. If it comes into contact with your eyes, rinse with a steady stream of tap water for at least 5 minutes. If you experience nausea, headache, or vomiting while using probenecid, it's important to let your doctor or pharmacist know. It's also important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. However, it's important to contact your doctor if you experience any of the following: persistent nausea or vomiting, dark urine, swelling, loss of appetite, unusual tiredness, stomach or abdominal pain, muscle loss, signs of infection, vision changes, increased eye redness or irritation, increased eye pain, confusion, or yellowing of the eyes or skin. While serious allergic reactions to this drug are rare, it's important to seek medical help immediately if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. And remember, if you're in the US, you can report any side effects to the FDA, and if you're in Canada, you can report them to Health Canada. This medication can cause serious kidney problems, so your doctor may prescribe another medication and direct you to receive fluids into a vein to prevent this. Be sure to tell your doctor right away if you experience any signs of kidney problems, such as changes in the amount of urine, frothy urine, or bloody/pink urine. It can also lower the body's ability to fight an infection, so be sure to let your doctor know if you develop any signs of an infection such as a persistent sore throat, fever, or chills. Before each dose, lab and/or medical tests should be performed to check for these side effects. It's important to keep all medical and lab appointments. Cidofovir has caused tumors in lab animals, so it should be considered potentially cancer-causing. Be sure to consult your doctor for more details. Before using Cidofovir, make sure to inform your doctor or pharmacist about any allergies you have to this medication or similar medications. Also, let them know about your medical history, especially if you have diabetes, a ganciclovir eye implant, or kidney disease. This medication may cause changes in vision, so it's important to avoid activities that require clear vision until you know how it affects you. It's also recommended to limit alcohol consumption while taking Cidofovir. If you're an older adult, you may be at a higher risk for kidney damage while using this medication. If you are pregnant, Cidofovir should only be used if absolutely necessary, as it may harm an unborn baby. The manufacturer suggests avoiding pregnancy while using this medication, and both men and women should use effective forms of birth control during treatment and for a certain period after stopping the medication. It's not known if Cidofovir passes into breast milk, and if you have HIV, breast milk may transmit the virus. Consult your doctor before breastfeeding while using this medication. Always follow your doctor's recommendations and guidelines when taking Cidofovir. It's important to be aware of potential interactions with other medications while taking Cidofovir Vial. This includes medications that may harm your kidneys, such as amphotericin B, foscarnet, and pentamidine. It's best to avoid these medications within 7 days before and during treatment with Cidofovir Vial, as it could lead to serious kidney damage. Additionally, be mindful of nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, as they may also be present in other medications. Always check the labels on your medicines and consult with your pharmacist to ensure safe use of these products. If someone has taken too much Cidofovir Vial and is experiencing serious symptoms like passing out or difficulty breathing, it is important to seek immediate medical attention. This can be done by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Symptoms of overdose may include a change in the amount of urine. It is important to seek help right away in case of an overdose. Remember to always use this medication as prescribed by your healthcare provider to avoid any potential risks or complications. Make sure to follow up with your doctor for any necessary lab tests or medical exams while taking Cidofovir Vial. It's important to keep all your appointments and stay on top of your healthcare routine. To reduce the risk of transmitting HIV to others, it's important to use a reliable barrier method during sexual activity, such as latex or polyurethane condoms or dental dams. Make sure to consult with your healthcare provider or pharmacist for more information on how to best protect yourself and others. Make sure to take each dose of Cidofovir Vial as prescribed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist immediately for a new dosing schedule. Do not take a double dose to make up for the missed one. If you miss a dose of the probenecid, inform your doctor or pharmacist right away. You may need to adjust your Cidofovir dose accordingly. Be sure to follow the product instructions and consult with your pharmacist on how to store Cidofovir Vial. Keep all medications out of reach of children and pets. Do not dispose of the medication by flushing it down the toilet or pouring it into a drain unless instructed to do so. Properly discard the product when it is expired or no longer needed, and consult a pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.